joining us.
Talkline Network Radio, America's longest-running Jewish broadcast network, the voice of the Jewish community.
Welcome to the podcast. You are now tuned in to this episode of our podcast. Today we are going to interview some of the greatest and most influential minds in our field. And now, please welcome your host.
You're listening to Talkline with Zev Brenner, America's premier Jewish broadcast on the air since 1981.
And we're back. Did you know there are over 600,000 children in Brooklyn? That's right. Tremendous number. And Maimonides Medical Center has really upped what it's doing to take care of Brooklyn's children. They have now a new pediatric emergency center located, of course, in Brooklyn. Our guest right now is Dr. Alexander Arroyo. He is the director of Pediatric Emergency Medicine for the hospital. That's Maimonides, and which is Brooklyn's only standalone children's ED, the only children's trauma center. The main center was established 45 years ago. They've been providing pediatric emergency care to 30,000 children in Brooklyn for a range of conditions, including allergies and reactions and injuries and acute illness. And the New York State Department of Health recognizes a small number of hospitals for the dedication required to meet the standards that care established by the American College of Surgeons Committee on Trauma. And Dr. Arroyo is responsible for a team of board-certified pediatric emergency medicine physicians as well as residents. Welcome to the program. Thank you for joining us.
Thank you very much, Zev. Very excited to be here.
You know, I'm excited to have you. I didn't realize over 600,000 kids in Brooklyn. Wow.
Yep, there's more kids in Brooklyn than there are people in Boston.
That's amazing.
And Boston has 3 pediatric trauma centers.
Wow. And a lot of that children's growth, of course, is to the religious Jewish community that can have 10 or 15 children and certainly keeping you busy. And that's why you established a new center to help deal with these situations, correct?
Correct. So, our center is the first of its kind when it comes to being standalone emergency for pediatrics, which is, it's revolutionary. The site is 4.5 times larger than our current site right now that we were previously in. Everything is modern, everything is brand new, everything is amazing. And it is truly an honor to be the leader of that.
Wow, it's a brand new ED. Can you tell us, like, what makes this center, your center, different than other centers in Brooklyn?
Well, we're the only trauma center for pediatric patients in Brooklyn, in the whole of Brooklyn. So all those 630 kids you were mentioning before, if they have a traumatic injury, would need to come to us, which is a tremendous, blessing for us to be able to have all that under our wing. So for us, that is one of the most important things of this facility is that we're able to offer that. It is also the only standalone children's ER, which when I say that, it means that it's not completely attached to an adult emergency room. So if you've taken your kids to the ER before, you may have to walk through the adult emergency room to have your kids seen, or your kids may actually be seen in the adult ER amongst the other adults. And this is a completely separate unit, standalone, where we just focus on kids, and your kids are not going to be exposed to some of the things you may see in an emergency department in an urban city like New York City.
So what you're basically saying is that it's important to have children should have their own emergency department, not connected or to walk through what the adults go through.
Exactly. I mean, it's a scary enough place to begin with because you go there and you're worried about children. They're concerned about what's going to happen. And anytime a kid goes to a doctor, am I going to get a shot? Is this going to be painful? And if they have to see other people there who are in various states of illness, it also is very distressing. It's also very distressing to the parents as well, too. And, many of the complaints that we had previously was the fact that, there's this mingling of patients where you have adults and kids who are both being treated simultaneously. And to have our own standalone pediatric ED where we're just taking care of kids is, brings the level of anxiety for the parents and also the kids completely down.
Understood. People are suffering from stress these days. Whatever can be done to lower the stress is certainly very, very important.
Yeah. And I work in probably the most stressful zone you could ever imagine being in, right?
I can imagine
your kids in.
With parents coming
in. Yep, absolutely. They're concerned about their well-being, their health. They're really worried about them, so they bring them in. So the stress level is already magnified, and to take some of that stress away by having dedicated people who know how to deal with children in a child-friendly, only child ER is important.
So I guess that's what you're also delineating is what the advantage would be of having an emergency department connected to a children's hospital.
Correct.
And of course that gives them peace of mind. And the truth is that, it's a different dealing with children than with adults. You have to have a lot more patience, and you have to deal with the parents also. And a lot of times they're
Correct.
hysterical
Yes.
coming in. I could imagine they're hysterical. So you gotta deal with the parents, and you gotta deal with the children at the same time.
Absolutely. And it's, it's a skill that it takes a while to develop. And, like you said before, the physicians that I have under my watch have all trained in pediatrics for 3 years and then went on to train in pediatric emergency medicine for another 3 years. So we have a significant amount of training to deal with situations, especially children, for parents.
Now, what does it mean that Maimonides has the only pediatric trauma center in Brooklyn?
So trauma is regulated by the American College of Surgeons. To be a trauma center, you have to pass a rigorous, checkpoint test of various things that you need to have in play. You need to have a neurosurgeon who can operate on anybody who has any brain or any neurosurgical issues. You have to have orthopedic surgeons. You have to have plastic surgeons. You have to have a litany of people who in the medical field will be able to deal with any kind of traumatic injury that you may have. So to do that, it requires a lot of funding. It requires a lot of pieces to be in place. Many hospitals don't do this. There were previously a couple other children's hospitals, a couple of children's EDs who were trauma designated for pediatrics, but they lost that trauma designation because they just couldn't keep up with the need to have the right people on staff. So Maimonides about 10 years ago committed to being a trauma center to be for both adult and pediatrics. And now we're the only standalone. We're the only pediatric trauma center in Brooklyn, which, like I said, prior is important because there are a lot of kids in Brooklyn. There's really no need for a child to go to Manhattan to get, trauma care if we could do it here. The faster you can get to these kids, the faster you can start taking care of them, the better their outcomes are. So having someone cross a bridge for 35 minutes, already losing this small window of time you have in a critically injured kid who you need to get everything. If they need blood, they need surgery, we can do that immediately. And that 25, 35 minutes going to the city could be
Makes a difference. Makes a big difference.
A massive difference.
Now you mentioned, and I mentioned before, I was shocked by the number, 600,000 children in Brooklyn. Wow, that's really amazing. But a lot of it is fueled, as I mentioned earlier, by the Orthodox and Hasidic community that can have 10 or 15 children, a lot. So because you have so many Orthodox patients coming to the hospital, give us a background. Walk us through is how you work with the religious and cultural needs of the Frum Orthodox community and the patients in the emergency department specifically.
Sure, Maimonides has been entrenched into the community culture for as long as it's been there. I was born. I won't tell you when, but I was born in Maimonides Hospital. As was I, honestly, because I grew up in Borough Park too. So I'm a neighborhood boy. So we're entrenched in the community and the culture. We have many programs in the hospital that caters to the community, where helping them get home on Shabbos, helping them get specific things that they need, medications if they can't get it on Shabbos for if they're unable to fill a prescription for us as well. We have a dedicated Shabbos entrance that we built into the floor plan to let the community come in through and exit through, so they don't break any rules and break any laws. The whole kitchen is kosher. And we have a great patient rep department that is really attuned to this and is able to help us when we have a specific need that pops up. Like if we have a long holiday and someone's really going to have a difficult time getting medication, we can, from our inpatient pharmacy, fill that medication, give them 2 or 3 days worth of medication so we can go home with to manage that. So amongst the patients that are here, we do get a lot of transplants that come in as well from Muncie, from Lakewood, especially for the holidays. So communicating with their pediatricians there as well is something that we're frequently do as well. Amongst also the pediatricians in Brooklyn who take care of the community. So if you've been in Maimonides for more than a few years, you're very aware of the inner workings of how to use our system to help our patients the most. And that's not just the community patients, that's all the patients.
Well, there's a special emphasis on the children, especially in the community, because of so many. So a lot of them will have you deliver 10 or 15. Is there a record number, by the way, that you know about of births where somebody had Like
That's
18,
a great question. I think the most I've heard of is 21.
21, one person having 21 kids. Okay.
Correct.
I was wondering. Now, you mentioned before that one benefit of having this pediatric emergency center in Brooklyn is that people don't have to travel over the bridge, get stuck in traffic, and time matters. So how does it work? Walk us through it. Let's say somebody needs to go to the emergency department. Can you make an appointment with the emergency department? Is there a long wait? How do you make the kids and families comfortable during that time?
So, the one good, well, the many good things, but the advantage of having a new center now is that we have many ways to come in. You can come by ambulance. If you have obviously a life-threatening or a life-concerning issue, you can walk into the front door. Or now we have the ability to actually make appointments off the what's called Maimonides app, which you can download on your phone. Or you can go to the website, make an appointment to let us know that, hey, I'm bringing in my son. His name is John Smith. He's 12 years old. He has a laceration or he has an injury to his finger, just so we can get a heads up that you're coming. Doesn't mean you'll go get to the front of the line, but we have a heads up that you're going to be there. The good thing is that we could also call the patient back because it's in our system and see if they didn't show up, what had happened to them and if they still require. The other good thing is that my staff works pretty quickly, and the average wait time to be seen by a doctor once you hit the door, approximately 15 to 20 minutes. You can't promise it every time, but
Right.
for the most part, you'll be picked up by a physician within about 15 or 20 minutes when you get to the hospital. You will see a triage nurse than that, who will determine and decide how severe the illness is, if you could wait a little bit, if you could be brought back immediately, or if you need to be seen ASAP. We're also doing something called the bedside registration and triage, which basically means that if you enter the facility, we will bring you to a room if a room is available, have registration, and the triage nurse who takes her find the story about what happened, do it all at the bedside, so you're already in the ED when you walk through the front door, which is something we're doing in our Bay Ridge site, which takes care of both adults and pediatrics patients, which Maimonides runs in the old Victory Memorial Hospital. And it's been very, very well received because we're really not using our waiting right now.
By the way, do you use AI at all?
We have not yet. There's a program looking for AI to do some transcription for like your notes when you're speaking to a patient. There's just some people piloting that right now, but that's going to be in the future. And I've been to a couple of physicians as an outpatient for various things that have used AI on their iPhone where they, to me, I tell them my story, they examine me, and they talk their exam out loud, and it's able to transcribe that conversation into a little note that they could put in the chart, which means great things for us because then I'm spending less time documenting. I'm spend so I can have more time with the patient.
What's the one thing you'd like our listeners to know about the new emergency department?
I really want people to know that you don't have to go to Manhattan for quality care. In the years past, decades past, everyone felt that you had to run to Manhattan to get quality medical care. The right medical care with the right specialists, caring specialists who know how to take care of your children is in Brooklyn. It's at Maimonides. We want to make you feel comfortable. We want to make you feel that you don't have to travel for your health care. We are doing it right. We're doing it correctly. We see in a large number of kids, we have amazing outcomes. We are there. We are close. We are ready to help at any moment, at any hour of the day or night. And we will treat you like your family.
You're doing amazing work, and it's important, and keep those children healthy. And that's our future. And 600,000 children in Brooklyn. Amazing. Dr. Alexander Arroyo, Director of Pediatric Emergency Medicine at Maimonides Medical Center. Thank you for joining us.
Thank you, Zev. Appreciate it.
Thank you for tuning in to
Talkline with Zev Brenner, America's premier Jewish broadcast, the pulse beat of the Jewish community.
For continuous Jewish programs, TalklineNetwork.com, or our 24-hour-a-day listen line at 641-741-0389. For past shows, you can find us on iTunes, Spotify, Amazon, YouTube, Instagram, and all major podcast platforms, or jewishpodcast.org. Thanks for listening to the TalklineNetwork.com.
Follow us on Facebook, Twitter, and Instagram.
Anyway, thank you.